So what's special about pediatric orthopedics is that we're treating not only the patient, but we're also treating the whole family. So developing that bond with a parent or a caregiver to be able to put your trust in the team, not only the surgeon, but the therapist and the nurses, and know that we're kind of really working together. I think that can be something that can be scary to parents and patients. It can be something that can be concerning. But I think what's great here is that we really do have that subspecialized focused care where it's really kind of a 360 look at the child. One of my favorite things about being a pediatric orthopedist is that I get to treat the whole child. So I see both spine and extremity conditions. So I see kids of all ages, and we see things like scoliosis and back pain. And then we also see kids who have things like hip dysplasia or Perthes disease. We see children with foot conditions like clubfoot or flat foot. And then we also see kids who have rotational or angular deformities of their legs. And these are things like in-toeing or knock-kneed or bow-legged. And then some of the most routine stuff we do are things like injuries. So these are things like fractures or dislocations, joint sprains or muscle strains. And our goal is really to get kids back to doing what they love to do. When a patient or parent is thinking about choosing MUSC to care for their child, one of the things that's really reassuring and comforting is that they should know we have a comprehensive, dedicated, subspecialized team that really provides all facets of that child's care. And that should really be apparent and obvious to them from the moment they walk in the door into our clinics. And if that child ends up needing surgery, the nurses, nurse practitioners, physical therapists, and other people on the inpatient team, they'll really know that we're all working together. So although we all have different roles on this team, we all have the same goal, and that's really to provide outstanding clinical care. How we're changing what's possible in pediatric orthopedics at MUSC is that we're continually driving for improvement. So we participate in clinical research, we educate our next generation of residents and medical students, and we're providing outstanding clinical care. So I think what's wonderful here is that not only are we focused on the day-to-day excellence, but we're really driving towards the next step in the future.